Good morning, everyone. It's a pleasure to be here and to really celebrate what this represents today. And I just struck by Chip's remark that breast is best. I think that's just a really well put slogan for what very seriously is a very progressive move that starts here at Shady Grove. And certainly there are some other hospitals around the state that are recognizing how very influential those hours that a mom is here with you in terms of setting the pathway to successful breastfeeding. So Shady Grove is a wonderful provider, not only in this particular community, but really leading the way with other hospitals around the state. So on behalf of Secretary Sharfstein and the entire state and local public health apparatus here in the state, that sounds kind of awesome, but we are very, very pleased to be here. And to kick off this event, this is very serious business. You know, in public health, we look at outcomes, particularly outcomes for babies. We have been pushing now for 4 years for improved outcomes for babies, and we have been making a difference. So if you look at the data, for example, the number one indicator that any society looks at in terms of the overall well-being of infants, it's infant mortality. And we have progressively moved that number down to the lowest that it has ever been in recorded Maryland history. That didn't happen easily, and that certainly didn't happen just by people in public health. Most importantly, that happened through the collegial work together with hospitals, with providers, by that I mean doctors, nurses, with all kinds of caregivers, and with people themselves, with families, with moms, parents, people understanding steps that can be taken, which individually may not seem like a big deal, but collectively, when we roll up all kinds of good behaviors, whether that's hospital behaviors, nursing behaviors, or parent behaviors, when you roll those up together, what you get is an infant survival rate, that is the best that it has ever been in Maryland. So I am so very proud to be here with all of you, because I know that that's the work that you do every day, is protecting our youngest and our sometimes most frail residents in Maryland. So I want to celebrate this. I want to give you a little bit of background about what this kicks off today, what these recommendations, what they're all about, where they came from, and what we expect to see as a result. First of all, what we are proposing here is an opportunity for every hospital in the state to develop an environment, to consciously develop a supportive environment that does help moms begin breastfeeding and continue breastfeeding. Now that sounds pretty straightforward, but I can tell you as a relatively recent new grandmother, and I can't get too much into my family history, but I had this wonderful daughter-in-law who, had a baby in the end of August. And she was a committed mom. She's going to breastfeed, and in fact, she's a nurse practitioner. And she realized what a challenge that is. It's not easy. It sometimes doesn't come naturally. Sometimes babies don't feed on demand. It's a learned behavior both by the mom and the baby, and there's nothing more important than a nurturing environment with a coach and some dedicated cheerleaders gets you through some of those humps. So I can say that personally, and I can also say professionally, that we see lots of moms who are committed while they're pregnant to breastfeeding, but after delivery, after they get home, the rates of sustained breastfeeding are far, far lower than what you would think from their earlier commitment. So how can we keep that commitment going, the nurturing environment that happens so influentially here in the hospital? So what this policy does is it gives hospitals in Maryland an opportunity. And I want to say first and foremost, it gives. So this is not mandatory. This is not a regulation. This is voluntary. And that really is the spirit of quality improvement of most of what we do in clinical practice. We develop best practices and we disseminate those best practices. So on a voluntary basis, we are asking hospitals to do one of two things. To either commit to go to the pathway of baby-friendly hospital. That's actually not just a nationally, but that's an internationally recognized certification by the World Health Organization that is evidence-based. It's 10 steps, and that actually is the pathway that Shady Grove is on. So that's option number one, to commit as a hospital to go to that pathway to become baby-friendly certified. It's not easy. It takes work, and so it's not something that you can say, yes, I'll do that tomorrow tomorrow and do it. It's a process, so commit to that process, or alternatively, to a process that we've developed here in Maryland, which we call Maryland Best Practices Hospital. And to become a Maryland Best Practices Hospital means that you adhere, as a hospital, you adopt to those same 10 steps, and I'll review them very quickly in a minute, but the same 10 steps that are very familiar to baby-friendly hospitals, the difference being that instead of having the international organization that certifies a hospital as being baby-friendly and continues that certification, in Maryland, we'll call it the Maryland lookalike. So we're asking hospitals to voluntarily commit to a pathway to either go baby-friendly or go Maryland best practices, and share that commitment not only with us at the state, but most importantly, share that with your community, with your patients and your constituents. Evidence shows that these 10 steps make a difference. And as I said earlier, sometimes it's those little steps, those little things that seem relatively straightforward, common sense, but if you put them all together, those 10 steps make a difference, evidence shows, in terms of adoption of breastfeeding, and what's really important, continuing breastfeeding at least for 6 months, hopefully past that 1-year mark. So sustain that. Let me tell you how we got to this very quickly. This is a culmination of a process that was well over a year, involved, I think, some of you. We had stakeholder meetings because we at the state wanted to learn from the hospital's experience what's working, what are some of the barriers, what's tough to do. So we had a series of meetings, thought we got it right in terms of a draft policy recommendations of those 10 steps, put that up on the internet, on the website, asked for comments. We didn't get it quite right. We got about 150 comments, very, very helpful comments that came back and helped us refine what we have today as the final policy, those 10 steps. And I will say that as a result of that very inclusive process, we feel real good now, because it's not a situation of coming in and imposing some kind of external set of criteria. These are ones that have been developed collectively throughout the process. So we're asking hospitals to commit, and we're asking hospitals to let us know through a self-assessment. So a hospital needs to take a look at what their current practices are, what the staffing training is, lots of the kinds of variables to understand how far a hospital is today from that goal. So to do that self-assessment this month in November, and then commit by the end of the year in December to which pathway the hospital will take, recognizing that it is voluntary and recognizing that it's certainly a journey. I do want to say that as influential as hospitals are in those early days right after delivery in terms of setting a good environment and framework for breastfeeding, hospitals aren't the only solution, aren't the only partner in that. It is so important that when mom goes home, that there is a community, there's a network of support and consultation. And so what we want to do and are doing, and I actually want to recognize a really amazing leader at DHMH, our WIC director, Jackie Boris. Jackie, wave, because Jackie's been the heart and soul of this. You know, so many of you know that WIC is the Women, Infant, Children Nutrition Program. And so typically that's getting vouchers. You'll see folks in the grocery store making WIC purchases. But WIC is also so involved in the nutrition and well-being of moms and babies before they're born, and certainly breastfeeding is a huge part of that. So I want to thank Jackie. Is really getting national recognition for what WIC can do in moving breastfeeding forward. Anyway, as I was saying, Jackie and her team are working to develop local coalitions. So after discharge, when the hospital has done an amazing job, there is support in the community. Also, daycare. We're working with daycare providers to make sure that when moms pump and bring breast milk to daycare, it's properly handled, it's managed, and that the daycare staff are trained and understand that. Workplace. We want to make sure that when moms return to work, it's a baby-friendly workplace so that moms have a place to go to pump. And I'm not talking about the ladies' room. You know what I'm talking about. I'm talking about a lactation room where an employer supports breastfeeding. It's something that we're doing in the state of Maryland, in Maryland agencies, and it's something that certainly is being adopted as a partnership so that it's not just hospitals that can support these important practices. Let me very briefly walk you through the 10 steps, and then I'd be happy. I will turn it over to Dr. Rose, who's very, very excited about this quality improvement at Shady Grove. 10 steps, and I'll characterize them very simply. First, for hospitals to have a written breastfeeding policy. Secondly, to train hospital staff and how to adhere and implement that policy. 3, inform all pregnant women of the advantages of breastfeeding. 4, help breastfeeding women initiate breastfeeding within the first hour of birth. 5, encourage breastfeeding on demand. 6, show breastfeeding moms how to breastfeed and how to maintain lactation. 7, practice rooming in, that's 24/7. 8, give breastfed babies no food and no drink other than breast milk. And also for breastfed babies, no pacifiers and no artificial nipples unless medically indicated. And 10, foster the establishment of breastfeeding support groups. The last thing I want to say, those sound simple. They sound simple. I know they're not simple. There's a lot of work that goes into those 10 steps. I do want to recognize that breastfeeding for some moms is not an option. And so I do want to say that this is an environment. This policy will give moms an environment to make a choice. Some moms are not going to choose to breastfeed, and those moms need to be supported. Those babies need to be supported. So the objective here is to develop a nurturing environment in the hospital in order to maximize what we know is the opportunity for babies to take breast milk. Breast is best. Breast is the optimal nutrition for infants. But for those infants and moms that choose not to breastfeed, to have them be supported as well. So with that, I guess I'll turn it over to Dr. Yost. And again, appreciate the hospitality of Shady Grove in welcoming us here.